Hi everyone, and welcome back to PHAMCAST. It is 2025 and we are kicking the year off right. I am so excited to start this new year in studio, and you can see it's a new studio, which we're really excited about. We've got so much planned for this year, and of course, it wouldn't be the same without my beautiful co-host, Megan. How excited are you?
I am super excited. I mean, we're on the cusp of this whole new chapter, this new year. There's so many big things to happen, so I'm very excited. And I'm super excited that we've got a third here. Come on, this is amazing. Another blondie gal.
That's right, yeah. So having guests in the house, which we're gonna introduce Vicki to all of you in a moment, but first and foremost, we are so excited today to be welcoming not one, but two different physicians to talk about something that Megan and I are incredibly passionate about. Bone health, but more than that, changing the narrative around bone health, looking at it from a preventative lens. After all, this is Preventative Health Awareness Month coming up in February, and this is Preventative Health Podcast. So we are super excited. So without further ado, I'm going to introduce our first guest that is actually coming to us from Zoom today, and we are so honored to have her with us. So I'm going to put my glasses on here so I can introduce this wonderful radiologist. So Dr. Meghna Krishnan is a breast imaging fellowship trained American Board of Radiology certified radiologist. After completing diagnostic radiology residency from Yale University School of Medicine, Connecticut in 2010, she graduated with fellowships in breast imaging and abdominal imaging from Mallinckrodt Institute of Radiology, Washington University, St. Louis, Missouri in 2012. Dr. Krishnan has also been an early adopter of the RDMS technology, which we're going to dive deep in today. Welcome to the show, Dr. Krishnan.
Thank you, Margaret, Megan, and Vicki. I'm really excited and very happy to be part of this team. Thank you.
Well, and you know, we are so excited to have you. But before we can dive in, Megan, why don't you also formally introduce our good friend, Vicki Baldwin here. And I'm going to let you do the honors because you share something really in common.
Yes, we are both sonographers, have a history in sonography. Actually, Vicki is also having a history in X-ray as well. So she's got a little bit more under her belt than I do. But you know, when I first met Vicki, I could tell that she was just this wonderful spark and a great asset to the Echolite company, and so it's my pleasure to be able to introduce her. And I think this is going to happen. Vicki doesn't have glasses, so you're going to see us on and offing today. But Vicki Baldwin is the Senior Clinical Application Specialist for Echolite Medical Corp in the USA, where she oversees training and clinical applications across the country, which is a really big country and is very busy for her. Since joining the Echolite medical team in 2020, Vicki has been instrumental in the company's expansion into the US, forging lasting relationships and spearheading spearheading the introduction of this groundbreaking diagnostic technology. That was almost as hard as saying radio frequency echographic multispectrometry.
Yes.
And there will be a test later. With over 20 years of experience in radiographic imaging and ultrasound, Vicki holds certifications from both the American Registry of Radiologic Technologists and the American Registry for Diagnostic Medical Sonography in abdomen and vascular technology. She began her career as a medical radiographer in 2001 while completing her studies in diagnostic medical sonography at the Methodist School of Imaging Sciences in Memphis, Tennessee. Over the past decade, she has specialized in cardiovascular sonography and gained expertise across all ultrasound modalities. This girl is well-rounded. A passionate advocate for the advancement of medical imaging, Vicki is dedicated to leveraging new ultrasound technologies to improve and innovate current medical practices.
Wow, welcome.
That's a big one.
We are so excited to have you.
I'm excited to be here.
Okay, so let's dive in, Dr. Krishnan. So we are so happy to have you here, but I think for all of our listeners and viewers at home, can you really dive in and tell us kind of your background, your story, and why you're doing what you're doing right now?
So I'm a radiologist by profession. I'm a woman. I'm a mother. I'm a wife. I love what I do because I care about people. I want to care the best I can. I strive for that. The reason I joined radiology was because I really enjoyed problem solving, looking at pictures and trying to make assessment and try to see if there is anything that can help this person. If it, in terms of breast imaging, looking at any finding that could be an early sign of breast cancer, or maybe it's benign and so the patient can be comforted and reassured that it's good. So that's my motivation overall. And in this journey over the years, through all the learning and training and learning from other mentors and just coming to a place where I then, as a board certified radiologist, was providing this service, I realized each person is precious. Each person has a value and beautiful value. They make a difference wherever they are. And my little role is to help them in their journey of, if I can help, know if there is anything in their body as a way of imaging in their life that I could guide them to the next step to better health or preventative health, if at all. So that's my overall goal, whether it's breast imaging, body imaging, or bone health, like we are talking about today.
Thank you for sharing that, and clearly we're aligned, and the messaging about taking care of the patient in a holistic manner and working better together for prevention, that is exactly why we're here today. So one of the things that we're very passionate about and why Vicki has flown in from the US to be here in studio with us today is this new technology called REMS, and Megan made reference to that. Can you speak a little bit to why you adopted the REMS technology? We certainly know the benefits of it, but speak to that from your perspective as a radiologist.
Sure, thank you. So, as a radiologist, I have read many DEXA exams throughout my career. And, we would just do them and report them. And I would not see the patient after that myself because I'm not a treating doctor. I didn't know what happened to that patient after all and what were their individual journey situations, but I did what I was given. But then when I opened my own practice in Scottsdale, Arizona, and I was providing breast and body ultrasound imaging, one of my patients told me and asked me about REMS. And I was like, I've never heard this. What is this? And then I looked up more into it. I looked into the publications, the research, met with the company, met Vicki, and I had the privilege of also talking to other providers in the country who are providing REMS. And I educated myself, and I was very happy to learn that we have this option now. As a technology, we've advanced so much that why should there be only one modality? I mean, we know DEXA, no exam is 100% perfect, but does its job the best it can, and there are limitations. DEXA has its limitations too. Maybe the life of the cathode tube, maybe the positioning, maybe operator dependence. There are so many variables to this, even in terms of the having curved spine or having spurs, bone spurs. There are many, many details to this, even the stature of the person, comparing it to the 30-year-old, to get the T-score. And there are so many factors that play a role. And I just didn't know anything else till I learned about REMS. And I was so excited that this option is there. And then as I look further into what people are looking, I'm young, I'm not yet in that 65-year-old, so I'm not really into the screening for myself with DEXA, that I don't know the pain of it. But when I looked into the pain that people are going through in terms of knowing if this result of T-score and is really true or not, does this mean they should now take a medication or not? Are the side effects that are potential to this medication a part of it, or they were going through so many questions. I realized as small as social media, as small as Facebook groups, to understand what people are going through. And that bothered me. And that made me feel, hey, this is a place, if I can make a difference, I'm willing to. And that was when I joined, I spoke to Vicki and the team as such, the Ecolite USA group, and I was very happy, and it was wonderful working with them also, and decided with my husband's consent, of course, and everything goes into it, and being an ultrasound facility already, we scan the abdomen every day, and we know how to follow the lumbar spine, and I was very excited, and I'm so thrilled that this has no radiation too. I think the DEXA radiation is minimal, it's not a lot, but at the same time, we have this option to provide people who are younger, premenopausally or women. And it is a sad thing when a woman turns, say, 65 and she starts having DEXA, and then she's told, hey, you have osteoporosis. Now you come on, you do something about it, diet and exercise or medications. And she's thrown into this world of, I wish someone had told me earlier. So that's where I think REMS plays a very nice role in giving them a head start early on in life, because a woman goes, it's not just overnight at 65 when this happens. The years of premenopausal lifestyle, nutrition, pregnancies, and menopause itself, so many things, including breast cancer treatments, a lot of factors that a woman, if she had been told earlier, maybe could have started and done a better job than at 65 with a result that is very difficult for her to know.
Oh my gosh, Megan, I know what we're going to say.
Wow. Yeah.
What I want to say first is what you just said is so refreshing, and I'll tell you why. You know, Megan and I have had the privilege here in Canada to bring REMS to Canadians and physicians alike. And of course, it's the new kid on the block, as you said, compared to DEXA that's been around for a long time. It is wonderful to hear a physician, let alone a radiologist, be willing and open to listen to their patients, first of all, hear what their heart concerns are, but then more importantly, also dive in and speak to professionals to find out about this technology, look at the research and figure out that, oh, wait a minute, this is something that has value and could be integrated. We get a lot of pushback, don't we? And have
all the time.
Initially, because it's just a new thing. Physicians like you are going to be the reason, not just this technology, but preventative health, medicine 3.0 for the future is different because you're open to looking at all things and working better together. How refreshing, Meg.
Oh, refreshing is really the only word we can use right now, but I really love your patient-centered approach to this because we do meet a lot of resistance. There are, certain physicians who are unwilling to maybe research. The patients bring their REMS reports and they don't know about it. And what is so great about what you said in what you were just talking about there is that you hadn't heard about it before, but you felt it was important to learn about it for the sake of the patient and for yourself. But the more information you have, the more you can support people who are coming to see you. And I think that is so important for the rollout of this technology, and not saying one is better than the other. And we all know that musculoskeletal health is just interconnected with all systems of the body, and just this one snapshot in time gives us opportunity to look at those other systems and understand and really kind of dial in, with nutrition and exercise, supplementation, all those things, to really focus on the person as a whole rather than looking at this one exam result and then giving one option and then moving on. It really shows me that you care so much about the outcomes of the patient and the follow-up and all those. Sorry, go ahead. Yep.
No, so Dr. Krishnan, you also said, so patient outcomes, you've talked about that and how they can get ahead of an issue. They're able to get into action earlier, which is incredible. You're also, of course, with oncology. Can you speak just briefly, because perhaps our viewers don't understand the impact that oncology treatment can have on bone health and how REMS plays a role throughout the course of oncology treatment that can really change the outcome for future once they finish their treatments?
Sure. See, I'm not a treating doctor, so I may not know all the oncology medications in name, but I do know that as a body, as a whole, these medications do play a role in how they would work in bone health, including as in all other areas of the body. Now, in breast cancer, there are medications that are anti-estrogenic, that are anti-hormonal, that are part of treatment for those who have breast cancers that have hormone receptors. So that's one area that we know very well. There may be other cancers where there are other medications playing a role. And in these women, there is this sad risk that on one side, we are helping them with the breast cancer, controlling it. But on the other side, maybe we are, leading them in a path where bone density is affected. Now, nowadays we are seeing breast cancers earlier and earlier. Younger women are getting that too. So if you would wait for DEXA at 65, it may be too late for her. And if there were anything consequence in between before she reaches that, as little as a fracture, I'm sorry, it would be very devastating, not only to her, but also her entire family. So, and REMS, what I really like about that, about the technology is not only it looks at bone density, but bone quality.
Yes.
That is a very important factor. And it's too much to say at 65-year-old, now you got to build up your quality. So the quality is also important, which I think is somewhat more permanent than density. And so the earlier, the younger she gets to know that, she could do something about it proactively.
Absolutely.
And sometimes it's also runs in families. So congenital, developmental, there are genetic factors that play a role for osteoporosis. So younger women as early as 21 is what I understand from the REMS database, that we can start comparing them with the T-score and the entire analysis. So it would be really great if younger people start with it. And oncology women, definitely, I have seen myself in my practice. It's been about 6 months since I adopted REMS, and I have been so thrilled. Not because people are coming from far and wide, which I do see, I'm happy to serve, but each person is given that information, which I think is making a difference for them. Every patient who comes to our clinic for REMS, I have the ultrasound tech and myself, and we look at their previous DEXA scores and everything. And also the scanning is done, and then I go over the results with them as part of the entire test. And that is where they are, I think, finding that important role of understanding what this means. What is this T-score? What is bone density? What is bone quality? And then what is their 5-year fracture risk? And things like that, looking at the lumbar spine, looking at the two femurs. And what I love about REMS also is the fact that it is very strict in validity checking.
Yes.
If we are scanning a little bit off at the edge of the vertebral body or the vessel or something like that, it'll say invalid scan, which I think is very good, because it is very, very particular to get that information, which is important. That's why the patient came for the exam. So it doesn't just, give a number, some random number, and say that's who you are. It's very particular. It's built into it. So I really love that. Also, I like the consistency of the lumbar spine values and the femoral neck values. We do both the femurs in our practice. So we do three zones as part of the exam: the lumbar spine, right and left femur. So in that, the numbers are consistent. It's the person I see. It's not like, spine is some minus 3.4 and the femurs are minus 1.8. And it's like, can it be the same human? This REMS I love because I see the consistency. And it's giving more validity and more confidence that this is truth. For this, to the best we can with the technology in today's world, this exam, I think, is outshining the the other. I'm not against DEXA at all. I think every tool has a role, has a place, but wherever one falls short, we should have something else to counter or support. And so knowing the bone quality and overcoming the limitations of curved spine, where women or men, if that can be a challenge with DEXA, whereas in ultrasound, because we are looking at the abdomen from the front anteriorly, we're able to follow the curved spine manually, which is better. So like this, there are so many details, like even with patients with osteoarthritis or bone spurs, where the DEXA X-ray goes from back to front, and that X-ray can be stopped by the bone spurs if somebody has strong degenerative disease, and the DEXA may erroneously think it's a good result. But when we do the ultrasound, because we don't have to look at the posterior spine, but the anterior, we are more accurate. So like this, there are so many things about REMS that I really feel that in this day and age, more and more providers would do well to adopt.
Dr. Krishnan, on behalf of us three here.
That went way too fast.
That went way too fast.
We need to talk again. Yes.
You got to come back for another episode, and maybe we can do an entire 1 hour on women's health, because clearly your passion is palpable and your mission for prevention is aligned with what we're doing. Thank you for your time today, and we really look forward to sharing this. And of course, letting people know where they can come and see you. Thanks for joining us today.
Thank you, Margaret, Megan, Vicki, and everyone watching this podcast or PHAMCAST. And I wish you all the very best, good health, and always the best in every area of your lives. Have a wonderful day.
Same to you. So for all of you at home, stay tuned because we're coming back with this girl. Vicki's going to be with us. We're going to be diving deeper into what is this REMS and really looking at why it's going to be impactful in helping you become the CEO of your health. Stay tuned. We'll be right back.